With regards to feeding your baby, what I'd advise you to do is to take a look at the HDFT website, and if you follow the link it will take you to the area where you can explore infant feeding workshops, and it will explore all your different options available. By this stage of your pregnancy you may have made a plan for what you want to do with regards to feeding your baby. Maybe you've planned to exclusively breastfeed for 6 to 12 months. Maybe you've planned on feeding your baby with some mixed feeding, maybe doing a bit of expressing. But the message to send is that actually breastfeeding, just a very small part of it is about nutrition, and a lot of it is about our baby's healthy development, and in particular brain development and making emotional connections. And to offer your baby any breast milk at any point is an advantage. So do take a look at the infant feeding workshop. We'll hopefully bring this into a video presentation shortly as well. Women who choose to breastfeed for a prolonged period of time, and if we look at countries that have much higher breastfeeding rates than the UK, at around 6 to 12 months of age, think in particular the Scandinavian countries. The women who've chosen to breastfeed for 6 to 12 months are often women who have had some challenges with breastfeeding. But what happens is for these women, they have that resilience, that determination to stick to their plan, to keep going, and they know where to access help and support. And that is really, really important, to know where you can go to get some help. Before you go home from hospital, we will go through some breastfeeding information with you and to give you some contact numbers for where to get help and support if you need some more. So do have that ability to seek out help and support if you need it. Every baby is different, and some babies come out and have that skin to skin and instinctively seem to know what to do and kind of gently wriggle and nuzzle and find their way down to the breast. Others are far more vigorous and sort of jump and leap and latch and take it. And every baby is different. Some babies might need a little bit more support of a couple of days or a couple of weeks even to really, really master positioning and attachment. So please make the most of us. Please ask for help and support with your feeding during the time that you have your midwife there for support. If you're choosing to stay overnight, perhaps after birth, ask the midwife to come and have a look at your baby's positioning attachment. Even if you feel quite confident, just to have somebody to come and say, yeah, that looks brilliant. How does it feel? Is it comfy? And to point out to you the signs that you can tell your baby's well attached. All our midwives and our support workers and our student midwives are all trained to the baby-friendly gold standard. So they're all in a position to be able to give you that help and support. And it's really, really empowering to go home feeling confident that actually my baby is latching and feeding well. So please, please, please make the most of us. Ask for that support. So this takes us really nicely to what goes in the top comes out the bottom. Okay, so we're going to start exploring a little bit about nappy changing. Babies should pass their first wee and poo in the first 24 hours. And the first baby poo is called meconium, and it's quite thick and almost tarry-like in substance and texture, and is black in colour. If your baby hasn't passed meconium within the first 24 hours, you need to let us know. So if you happen to have gone home or had a home birth, then it's important that you contact the midwife and let us know. The baby will also pass their first wee in the first 24 hours, but this wee can be quite concentrated and feel kind of just a vaguely damp in the nappy rather than heavy and wet. Again, if you don't think your baby has passed urine in the first 24 hours, then let us know. If you're unsure, you might want to pop a little bit of cotton wool at the front of the nappy, and then that holds the urine a little bit better and is easier to see that yes, baby has had a wee. Baby's wee, when it's concentrated in that first couple of days, may have what we call some urates in. And if you take a look at the slide, you can see it's kind of a brick red, kind of orange sediment. And this is just because the urine is quite concentrated. As your baby starts to take in more milk feeds, the poo will start to change colour, and it will change from the thick black tarry meconium, it will lose the tarriness, and it will go to what we call a changing stool. So this is more brown or green in colour. And this is a great sign that your baby is taking milk and milk is being processed by the bowel. Particularly if you're breastfeeding, this is a really reassuring sign that your baby is taking milk in. By the time the baby is around 4 to 5 days old, the colour of the poo changes yet again to kind of a yellow colour, similar perhaps to korma or piccalilli or mustard, and it's quite soft. And the baby should be having 2 poos that are soft and at least £2 coin size in a 24-hour period, up till around 6 weeks of age, regardless of how you feed your baby. It may be that if you're breastfeeding, your baby may have more stools than this. But looking for these 2 poos a day is a reassuring sign that your baby is taking plenty of milk. Number of wet nappies will equate to the number of days old baby is in that first week as well. So on day 2, you should be feeling more of a weight to a nappy. You've maybe made a decision whether you plan to use disposable nappies or real nappies. There's lots of companies out there that kind of set you up with packages to use real nappies, probably much easier than it was for our parents and grandparents using real nappies. Gone are the days of kind of folding and nappy pins. They're really easy to use now with kind of press studs and liners, so you may wish to explore using those. If you have got a disposable nappy, what I would ask you to do is to take a dry nappy and add 3 tablespoons, so 3 15ml spoons of water. And what I want you to do is feel the weight of that in comparison to a dry nappy. And feeling that weightiness helps give you a sense of the heavy wet nappies that we're looking for as your baby is getting to 2 to 3 days old. So on day 2, baby should be having that heavier nappy and should be having 2 to 3 wet nappies. Day 3, 3 to 4, day 4, 4 to 5. Until your baby is around 5 to 6 days old, they should be having 6 to 8 heavy wet nappies alongside those 2 poos in a 24-hour period. And this is a reassuring sign that your baby is getting plenty of milk. So what are we going to need to change a baby's nappy? So the recommendation from NICE is that for the first 4 weeks, we don't use any products to clean or cleanse our baby, that we just use plain water. And the reason for this is, if you imagine the baby inside is in this lovely sterile environment and kind of protected from allergens and pollutants, and they come out into this new world and they're just having to deal with new exposure to the skin. So to overload our baby's skin with unnecessary products could potentially irritate our baby's skin. So just to use cotton wool and water for the first 4 weeks. So you're going to need a little bowl for putting the water in. Think about the temperature of the water you'd like your bottom cleaned in, and the same for baby. So not hot, not cold, it just wants to be warm. And tap water is perfectly fine. You don't need to use water that's previously been boiled. Some cotton wool pads or balls, or you may wish to use, you can get some reusable kind of cotton and wipes that you can pop in the water as well. And those can be laundered and turned round. Think about the environment you're changing your baby in. So you're going to want them on a safe surface that's flat. If you have a high changing mat, obviously common sense, don't you leave your baby unsupervised at a height. Or it might be that you're using a changing mat at floor level. And make sure you've got everything to hand, including your clean nappy, ready to go on, okay? Don't get baby all changed and think, oh gosh, I haven't got the clean nappy to put back on. So it's a bit difficult to demonstrate to a static webcam how to change a nappy, but bear with me and I'll try to run through it with you. So remember about that mutual gaze and spending time talking to your baby whilst you're changing the nappy, okay, reassuring them. This is a new process for baby as well, okay. What we need to think about is what our baby's laid on. So often as we're pulling baby's legs up like this to change their nappy, it can almost be like a bit of a lever effect. And as their legs are like that, then poo and wee can carry on coming. So if you've laid them on a beautiful, nice soft blanket, be prepared, okay, because that could end up covered in wee and poo as well. So maybe a muslin or a towel underneath baby, so if there is any more to come, we can catch it safely. So we're going to pull the tags off round the nappy, and if you can use the nappy sorry, it's very difficult to demonstrate this with just two hands. If you can use the nappy to wipe the worst of it off and then fold it underneath your baby like that, so that if they do carry on weeing and pooing, then it's just going to go onto the top of that clean nappy. Use damp cotton wool and don't be frightened to give it a bit of a wring out, because if it's really dripping wet, then it's just going to make a bit of a soggy mess. And you're going to give your baby a good clean. It's really important to get into all the skin folds, okay? So first of all, maybe clean the bottom. Again, it's really important to make sure you can see the point where the skin is clean, because sometimes you'll kind of look and think, oh my gosh, where does this end? I can't actually see any clear skin, it's gone right up the back. In which case it might be that you just gently turn your baby side to side so you can see how far up the back it's got. If it's kind of really up the back, it might just be easier to pop your baby in a bath to clean them that way. Do pull the clothing out of the way first, okay? So pull the clothing right up the back so you're not having to change vest and baby grow at the same time. Hold your baby's legs apart like that so we can kind of get into the skin folds. Little boys, when the penis is exposed to air, can start pointing in different directions and get that urge or that stimulation to have a pee. So for little boys, maybe for nappy changing, have a muslin at the side. So if you're not quite ready to get that clean nappy on and you notice the penis has sort of popped up or moved and is looking ready to pee, then you can just pop that muslin on top and the baby's not going to pee into their own face, okay? Little boys' bits do need physically moving around gently side to side, looking underneath and making sure that it's all nice and clean. Little girls, you're just going to use one firm wipe front to back. Don't wipe back that way because we're introducing infection potentially back towards the urethra. So one firm wipe front to back. Don't worry too much about parting the labia and getting right into the vagina to clean. The firm wipe front to back should do enough. And by parting the labia and trying to get too far into the vagina, potentially again it's just taking it higher up than cleaning it away. Once the baby is all nice and clean, then you're going to dry off with some cotton wool or a towel or a muslin. And the baby's got nice clean skin, particularly into all the skin folds. We don't recommend the routine use of any nappy creams. The best thing to avoid nappy rash and to have healthy skin in the nappy area is a clean bottom, so that it's attended to and baby's not left for prolonged periods of time with a dirty nappy on. If your baby does develop a little bit of soreness, then to get some advice from a healthcare professional, we may advise to use a little bit of a barrier cream. A barrier cream kind of helps to protect the skin that's got sore from the wet contents of the nappy. And if you're advised to use a barrier cream, literally just dab a little bit on the area that's sore, don't smear it all over the bottom. It might be that actually the nappy rash needs a bit of antifungal treatment as well. So the midwife or the health visitor or the GP may be able to advise you on that. Creams that don't have any barrier quality can tend to just make the skin more soggy and moist, and a lot of those creams are quite astringent in smell, so we don't routinely advocate the use of those. As well, we don't advise the use of any talc for nappy changing. So baby's all nice and clean and dry, and we're going to put the dry nappy back on. So we don't recommend any particular brand of nappy. Many of the brands have this kind of line on the front that changes colour when the nappy is in need of changing. So it's a means of being able to have a little peek and seeing if the line has changed colour. You're going to get the bit with the tag, Velcro tags to the back, and you're going to pull baby's legs and get it up the back to about that level. You're going to pull it up and over at the front, and little boys physically need pointing downwards into the nappy. If you leave the penis stuck up or to the side, you might find that you end up with a dry nappy and wet clothes because the flow of urine has gone up and not down into the nappy. So just bear with me whilst I pop this baby on my knee to fasten the tags. The tags want to be tight enough so that the nappy will hold on if you lifted your baby up, but not so tight that it cuts circulation off. And hopefully you can see there that I've just folded the front of your baby's nappy down. And if you imagine where the press stud is, that this is the baby's little stump of umbilical cord. The cord takes around 7 to 10 days to dry up and drop off, and if it's kept out of the nappy like this, it means that it's not getting messed up in the nappy contents. So just fold the nappy over until that cord drops off. Turn your folds and your pleats out on the nappy so that it helps encase the nappy contents. Obviously you're not going to hold your baby like this by the neck, okay? I'm having to hold baby like this to show you. And that's all there is to nappy changing. So have a go at your first one. Ask for help if you need it. Whilst your baby's got that cord on, the best thing to do is leave it well alone. It separates by all the natural bacteria and the umbilicus being involved in the process. So too much cleaning, you're potentially taking that good bacteria away. If your baby has a little bit of stickiness to the cord, then just give it a wipe round, some damp cotton wool and dry it off again. If your baby is being bathed with a cord on, again, just dry the area off after a bath. Years ago, we were maybe advised to use an antiseptic powder or a spray on the cord area to help it separate. But the research showed that perhaps this was just killing that good bacteria that was meant to be there and just interfered with the process. And typically the cord will drop off around 7 to 10 days of age.